Blood vessels do not show clearly on normal X-rays, so a special dye needs to be injected into your blood first. This highlights the arteries and veins in and around the brain, allowing the doctor to see any problems. You'll lie flat on your back on a special table equipped with a fluoroscope, a rotating X-ray imaging device. A small incision or cut is made over one of your arteries, usually near your groin or wrist. The size and location will vary depending on your personal requirements. A thin, flexible tube, known as a catheter, is inserted into the artery. The catheter is carefully guided to the area that's being examined. A dye, called a contrast agent, is injected into the catheter. This dye shows the inside of the blood vessels while a series of X-rays are taken. The fluoroscope will move around your head to record pictures from multiple angles. The dye will reveal any abnormalities, such as an aneurysm in the arteries. An aneurysm occurs when the walls of the artery weaken. The high-pressure blood can cause it to expand or bulge outward like a balloon. If an aneurysm is found and it appears to be treatable, then the doctor will try to stop blood flowing into it. There are a number of different techniques that may be used to achieve this. It usually involves deploying coils. The coils are made of soft platinum metal and are shaped like a spring. These coils are very small and thin, similar to a human hair. The idea is to fill the aneurysm and prevent blood from flowing into it. However, if the neck of the aneurysm is wide, there is a risk that the coils may not stay in place. If this is considered a risk, a wire mesh tube called a stent may be placed. It is carefully guided to the correct location, then deployed. The stent is designed to open and lock into place. The aneurysm can then be coiled safely. If it's not possible to place any coils, then another option is a flow diversion stent. This is a stent that diverts blood away from the aneurysm. By stopping blood from flowing into the aneurysm, it may reduce in size over time. When the procedure is finished, the catheter will be removed. Pressure will be applied to the groin or wrist to reduce the risk of bleeding. Sometimes this may be done by hand or with a pressure cuff device. You'll be asked to lie still for a few hours to prevent bleeding from the cut. You may have a sore groin or wrist for the first few hours or days. However, this will settle with time. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.